Hi, I'm Jeff Gonzales, president of Trident Concepts, and today I'm here with CCW Safe to talk to you about my new book, The Concealed Carry Manual. Today we're going to be going over the chapter on training safely. So what does that really mean? Well, at some point you're going to need to take your firearm to the range and you're going to need to start using it. Practicing, training, getting to know it a little bit better. So with that being said, we need to make sure that we establish some safe training habits that will transition with us as we become more and more skilled with our firearm. So the very first thing that I do is, as I try to emphasize that safety is a skill that you need to develop. It's like anything else. You've got to practice it, and you've got to practice it, and you've got to expect it from you and everybody else around you that you are working with. So even if you're not the most experienced when it comes to firearm ownership, there should be a certain expectation about everybody behaving safely in the same way. So when I talk to people about, hey, start early as far as developing safe habits and safe practices, because they're going to go with you for the rest of your time or career that you are operating or handling firearms. So the next thing I talk about is, let's be sure that we know the safety rules. And there are really 4 rules. I talk about them often. Number 1, treat all guns as if they're always loaded. Number 2, keep the muzzle pointed in a safe direction. Number 3, keep your finger on the home position. And number 4, know your target and what's beyond. So make sure you don't just know and understand those rules, but that you employ them anytime you're handling firearms. The next thing we talk about is the operation of your firearm. It's extremely important that you understand how the firearm works. I'm not talking about all the internal aspects of the firearm, but things such as loading and unloading. How do I work the controls? What are all these little buttons and levers and knobs? How do they work? What do they do when they are working? If you have a little bit of baseline understanding of the features and controls on your firearm, that means you're probably going to be a little bit safer when it comes to handling the firearm. If you don't know anything, you may not know how to properly deactivate the safety, or you may not know how to activate the safety. The next thing we talk about is, what sort of protocol should you follow when you are maybe training at a range? Well, aside from locations having their own set of rules and their own set of expectations, there are just some common courtesies that you want to do. Number 1, don't be handling firearms behind people. That's a big no-no. If you're going to do anything, make sure that you're handling a firearm in a safe area, in a safe direction. Other things to think about are, have you brought sufficient eye and ear protection? These are things that kind of like go along with a protocol, because it's important that you protect your eyes and ears from whatever type of damage that you can sustain, whether it be brass casings coming at you in the face, or whether it could be the loud noise becoming a little bit painful or causing a negative reaction. These are things that you want to kind of take into consideration when it comes to the protocol. The last thing I talk about is kind of like an uncomfortable subject, but it's dealing with the worst case. What if we have a medical emergency while we're out training? Whatever it could be something minor to major. But I talk about being prepared for that, and that means that we should probably have a medical kit, and we should know how to use the contents of that medical kit, whatever they are, whether they're bandages or pressure dressings or even a tourniquet. Let's understand how to use that medical gear. What you also need to take into consideration is having a plan to deal with those emergencies. And one of the things that I talk about is something as simple as, hey, here's my medical kit, it's in my bag. The nearest hospital is such and such direction or such and such cross street. We need to start to make assignments about who's going to do what. All right, I'll do medical, you call the EMS, and then just try to kind of keep things keep everybody informed of what you expect should an emergency happen. Now, of course, worst case scenario is that you're kind of out in an austere condition. Probably the most important thing that you can do is let someone know where you're going and when to expect you back, so that if something happens, at least somebody is aware of your general location and when they should start to worry. All right, so if you want to learn more, please check out the book, Concealed Carry Manual, and you can do that by going to concealedcarrymanual.com or post some questions down below. I'll be happy to answer them. Until then, I'm Jeff Gonzales. Take care and stay safe.